Key players in the health sector have met in Accra to discuss ways of improving emerging threats to mental health among children in Ghana. The high-level meeting, spearheaded by the Africa Center for Well-being Research and Advocacy, also known as Africa Well, presented findings on the growing mental health challenges facing Ghanaian children between the ages of 6 months to 5 years.
Anxiety, depression, and behavioral changes among children in Ghana, mental health advocates say urgent policy solutions is needed to reduce cases of mental health among children. At a stakeholder forum spearheaded by Africa Well, participants presented findings from its landmark study on children's mental well-being. For 2 years, researchers visited 3 communities in the South District and engaged 1,000 participants and 750 households to have more insight into issues on children's mental health. The findings highlighted a worrying rise in mental health issues among school-aged children, often worsened by stigma, limited support systems, and lack of trained professionals. A clinical psychologist with the University of Ghana and Africa Center for Well-being Research and Advocacy, Mr. Richard Appiah, said data from the research is critical in finding the right solutions.
We are very reactional to treating mental illness, but we have to also begin to look at the mental health of children from the younger age. And no one, to our knowledge, has looked at this in the past.
A senior lecturer with the Department of Child Health at the University of Ghana Medical School and a pediatrician, Dr. Adjoa Frani, described the findings as crucial.
The whole purpose of all this is for interventions to take place that would be in place for the children who are our future generation. They don't have a voice, but we can speak for them.
An assistant professor at the Miguel University, Dr. Marilyn Nana Ehun, said the workshop was a wake-up call for stakeholders to brainstorm and find workable solutions to emerging threats to mental health.
If we don't focus on this younger age to try to understand what are the factors that increase the risk of developing mental health problems, or what are the factors that protect young children, and then act on those factors, it makes it a lot harder to make those changes later on.
A senior lecturer at the Department of Social and Behavioral Sciences, Dr. Franklin Gloser, said it's time to explore other sustainable ways to improve on mental health among children.
Essentially, we're interested in seeing whether parents with mental health, how does that translate? Is it related to the mental health of children at a very early age? Often we are interested in mental health with children, adolescents, adults, but not children below the age of 5 years.
Panelists included representatives from the Ghana Education Service, Mental Health Authority, UNICEF, and civil society organizations. They emphasized the need for a national mental health framework tailored for children, more funding for services, and awareness campaigns to tackle stigma. Africa Well says it hopes the policy dialogue will spark a national movement to prioritize children's mental health in both government and community agendas.